Let's take a look at some data. Let's take a look at the official recommendations now, right? There's the AHA-ACC blood cholesterol guidelines. So why don't we just run through this? Who's an appropriate candidate for statin therapy, and how much do the statins typically lower your LDL-C?
Well, first of all, the ACC-AHA guidelines are just one set of guidelines. We have the NLA guidelines, we have the European guidelines, we have the American Association of Clinical Endocrinology guidelines, and they're all different, frankly.
Don't you wish they'd all get together in one room and hash this out?
Wouldn't that be nice?
Yes, so ACC-AHA is the one that, that promotes a % reduction in LDL cholesterol.
Okay.
The other ones still have targets or goals. So many of us, Howard and I know, follow the ones with the goals.
Okay, so what are the goals?
Somebody who's high risk, less than 70, although now ACE has one that's less than 55, and frankly, I think that's appropriate.
Yeah.
Okay. I mean, one thing I've seen in the literature is that there's no threshold. Lower
Correct.
tends to be better.
But
Right.
we knew that in 1994 when Scott Grundy from UT Southwestern drew a line linearly down to the left. There was no level of cholesterol at which benefit did still not continue to accrue.
I believe Nissen had similar data, right?
Yes, he did.
Yeah. So, okay, what are the guidelines? If 80 is good, why not 70? Why not 55? Why don't you guys just say, we're going to pay you to get it down to 30? And we're going to come back to that number. That's not a randomly chosen number.
Well, our obligation again is to look at the evidence, look at the established guidelines, whichever they may be, and make our coverage decisions based on that. And if
But
the guidelines,
which guidelines, though?
Well,
That's the problem.
again,
Correct.
You could certainly choose any guideline, but we generally choose the AHA, ACC guidelines.
A patient comes in with a cholesterol which is above where the ACC, AHA
Okay.
likes it to be.
Sure.
He wants it, or she wants to get that down, and he wants you to pay for it.
And we do.
But you do within some sort of structure. What do you want them to do? What is the mechanism by which you want them to approach this?
Well, it varies from insurance company to insurance company as to how strict they want evidence that the patient needs the drug. For most plans today, I would say that there is really no management of statin therapy. In other words, the statins are generic medications. We don't ask what their blood levels are. If they want to prescribe a statin, we cover it with no questions asked.
So now comes the idea of diet and exercise. If you didn't, and you're on 80 of atorvastatin and your LDL is 120, in comes the request for Zetia. Zetia is still a branded drug, and the co-pays for that can be $60 to $90 a month. And sometimes it's disallowed. Why? Because you decide, the industry decides, not you personally, the industry decides that that person's risk was not high enough based upon AHA-ACC guideline to warrant the extra money. And that's where the arguments start.
All right.
Yeah, I don't know of anybody who would deny coverage of Zetia.
Oh my God.
In a situation like
Give me my
that.
office
Come
number.
visit me
I'd be
too.
happy to supply
You now know two.
dozens.
Yeah, really.
But what does the ACC-AHA 2016 non-statin guideline therapy say
Well,
for
before
non-statins?
I answer that, I need to ask you a question. Which group has primacy, the FDA or our guidelines?
Ooh.
Primacy in the sense of
Who wins?
what? Who wins?
Yeah, there's a disagreement. Who wins, FDA or guideline?
Are you talking about off-label use?
No, I'm talking about FDA, on-label use, in the PI. Who wins? Shouldn't the FDA always win?
I was going to say, yeah, the
Right,
FDA, I
right.
think, is
So if you look at the FDA and you look at the PI for the PCSK9 inhibitors, and we prescribe them completely on label, we're often denied. And the reason we're denied is it's not in the guidelines. So their guidelines are used against the patients, whereas the FDA is ignored. That happens all day long.